Hello and welcome to the Faith Perspective, dear sisters and brothers. I'm Andre Achak, and right here, of course, on Catholic SG Radio. Now, on the Faith Perspective, we get the opportunity to discuss trending issues, events that are happening in the church and around the world. Now, every year, Caritas Singapore, which is the social community arm of the Catholic Church, launches Charities Week. You know that. I'm sure you're familiar with those brown envelopes. But now those envelopes have changed, right? So this annual fundraising campaign supports the work of more than 20 charities and organizations as well under this Caritas family. And this year's theme is Walk With Me. And Caritas can be said to be truly walking with their featured member organization today, which is ABLE. And ABLE stands for Abilities Beyond Limitations and Expectations. They are a social service agency, or SSA, that aims to enable the physically challenged to live with dignity and to have productive, meaningful, and independent lives. Now, today in the studio, to join us, let me introduce to you, first of all, from Caritas, Jeremy Khoo.
Hello.
Hi, Jerry. Welcome back.
Thank you. Good morning.
Now, Jeremy is a Senior Manager of Community Engagement and Development. And from ABLE today, we have Khairi Muhammad.
Hello.
Hi, Khairi. As well as Gladys Khoo. Hi, Gladys.
Good morning, everybody.
Good morning. Okay, so both of them are account assistants at ABLE Seas. And I'm going to start with Jeremy first. Okay, Jeremy, can you share with us the mission of Caritas and the intention, of course, behind Charities Week?
Well, Charities Week is our largest fundraising campaign.
And the oldest, I think.
And the oldest, 64 years.
Yeah.
And the objective for Charities Week, of course, is to help raise funds for Caritas and all its member organizations like ABLE and ABLE Seas. Right. The funds raised during this campaign are very crucial in terms of supporting the various important programs and services provided by our 24 different member organizations under the Caritas umbrella.
Right.
These programs and services are aimed to help the marginalized communities, including the poor and elderly, youth at risk, migrant persons, persons with disabilities or special needs, and those living with medical needs, and many more, actually.
Right.
Ultimately, aim for Caritas Singapore family for Charities Week is so that we can continue the work to help the vulnerable and marginalized, regardless of race or religion.
And that's the important thing, right?
Yeah.
It's regardless of any creed or anything of that sort. How's the response been like so far?
It's been good. I think we've been getting very good support from the parishes, especially parishes and schools,
Right.
where we have a lot of our donation envelopes. I'm sure you've seen on Sundays.
That's right.
We also have videos. We also on social media, etc. So as of last Friday, we raised about 4.5 million,
Wow. Okay.
which is hopefully on target to reach our target of 8 million.
Right.
And,
Okay.
We do distribute most of, if not all of these funds to the different member organizations under us.
Right. Right. Now, today, especially, I would like to ask you about the mission of ABLE. Can you share that with us?
Sure. ABLE's mission is to enable the physically challenged to live with dignity and to have a productive, meaningful, and independent life.
How long have they been around, ABLE? About 14 years?
14 years, yeah.
Right, okay. I remember going to their facilities at the Agape Village, actually, some time
that's
ago.
right, yeah.
You're still there?
Still there, yeah. The HQ is there, and
I was blown away by what they were doing there and some of the programs there. And that was some time ago, and I'm sure now it's improved a lot more.
Yeah.
How has the team and the partners at ABLE been, serving in this mission? I mean, it's a very specialized area.
That's right. So to achieve their mission, they actually work very closely with each client, consulting with a social case manager and the rehabilitation team to develop really tailored and individualized a rehab plan for each one. These plans are crafted in collaboration with the client,
Right.
ensuring that their goals and aspirations are at the forefront of ABLE's efforts. They provide a range of services to address the need of their clients, and these include occupational therapy, physiotherapy, and speech therapy.
Wow.
Yeah.
That is actually really, really taking time with each client and making sure that,
Correct.
Yeah. It's a really a journey all the way.
Each disability is different, right? And the reasons why they have been disabled is quite unique. So
Yeah.
you really have to understand the needs of each client.
Right, right. And today we're very blessed there. I'd like to thank Khairi for coming in as well as Gladys. Khairi, can I just start with you?
Sure.
Can you share with us what was your situation when you first came to Able?
I had stroke in 2020. I was hospitalized for about 4 months. Then after I was discharged, I had a home therapy, which lasted about 1 year. Then my therapist asked me what I wanted to do. So I told them I wanted to return back to work. So they introduced me to Able. And from there, they did some assessment with me. After the assessment is okay, then Able start the therapy session with me in 2021, and that rehab program lasted about another year before they deemed that I'm okay to return to work. So they asked me what kind of job I wanted to do. So I told them I like accounting.
Right.
So I think just now at the point of time there was a vacancy at Archdiocese, so they introduced me there, and after a while, then I started work at Archdiocese around May 2022. So I've been working there since till now.
You have an amazing memory. You have an amazing memory.
Thank you.
Yeah, that's fantastic. Can you share with us how did you get your injury?
Well, I believe it was due to my high blood pressure, which I've only found out when I went for my NS medical checkup. At that point of time, I had my medication, but my medication ran out during NS. So halfway through, I know I had no medication, but everything was okay for about 2 years, which until 2020 July,
Right.
which all of a sudden I had stroke.
Wow. Can you share with us, what was your greatest challenge, going back to work?
Initially, I would say the physical aspect, because have to travel and being physically limited at that point of time, there was like fear of traveling, taking the public transport.
Right.
As we know now, public transport most of the time is crowded and will be a bit dangerous for me. So I was like scared. But with the rehab at Able, they assist me to overcome this fear, and slowly I was able to be more brave to go out and take public transport.
Were you on the wheelchair at that time?
I was not. I was on I had this ankle support.
Right.
But after the rehab with Able, I do not need wear the ankle support. So I'm thankful for that.
Wonderful, actually. Thank you so much. Let me come to Gladys now. Gladys, can you share with us why you had to wear a prosthetic leg?
Oh, okay. I was found to have diabetes when I was 2015.
Right.
Due to like my meals was not in proper because of my work. So when I was admitted in the hospital for almost 6 months, doing 2 operations to take off those dye cell in my leg.
Right.
But unfortunately, it never goes well, and the final choice is to amputate my leg
Wow.
to save my life. So
Okay.
after that, I was staying in the hospital for almost 6 months to train up how to use the prosthetic leg. So that when I discharge from the hospital, I can do a simple chores in home, and also I can work again. So after my rehab in Tan Tock Seng, the staff over there actually introduced me to Akabe Village, the able.
Right. Why were you transferred from? I understand you were in Tan Tock Seng and you were doing physiotherapy as
Yeah.
well as occupational therapy.
Yes.
So how did that change happen, or why did it happen? Why did you move to Able?
Oh, because once they discharge, they wish you to continue with the therapies, everything.
Right.
So they actually introduced Able to me.
I see. Okay.
Yeah, and
did
once
you
they-
hear of Able before that?
No.
Not at all.
No,
right?
not at all.
But were you happy to go to Able?
Yeah. Because I even told them that I want to work when I discharge. So they say, yeah, able to help you with finding jobs and also doing the therapies together. So I say, yeah, sure, why not? So
Yeah.
I have actually approached Able for the helps that I need. So they had accept me, and then I start my therapy, and then also the social workers over in therapies helped me to find a job, and thankful to him, I got a job in ABC as an account assistant.
Wonderful, wonderful. Can you share with us, what was the biggest challenge, for you during your therapy and your exercises? Were you in a lot of discomfort?
Actually, no. Because when after the operations, I actually don't feel sad or anything. Just to me, it's I turn into another life, a new life for me.
Wow.
So things that is had to be done had to be done. So I will just accept the challenge and then go ahead for it, without thinking. I mean, like we Chinese say, if you're happy, you still have to go on. If you're unhappy, you still have to go on. So I choose the one which is happy.
You are a brave woman, and Khairi too as well. I mean, the thing is, there are some people who cannot find it in themselves, that strength to want to go on. But the two of you are, a wonderful testament of someone wanting to go on and live life as it is, right? So thank you so much for coming in to be with us and to share with us and to share with our sisters and brothers. Dear sisters and brothers, if you've just joined us, you are on the Faith Perspective, and I'm very blessed actually to be able to speak to Jeremy Khoo, who is a Senior Manager of Community Engagement and Development at the Caritas team, and also two wonderful clients of ABLE. And ABLE stands for Abilities Beyond Limitations and Expectations. So we have Khairi Muhammad as well as Gladys Ko, both of them account assistants at ABLE Seas. Now, we've been talking about challenges that you face and all of that. Khairi, can you share with us, how did the team at ABLE help you? Can you just be a little bit specific of some of the things that they helped you with?
First, they did an initial assessment on me when I transferred from home rehab to ABLE. So slowly they assess me. Then after the assessment is done, they see what they can do to help me return to work. Initially, we started with occupational therapy because at that point of time I felt that it was my weakest. And after a while,
What was the weakest part of? Was it hand movements, your physical movement?
I would
as a
say
whole?
at that point of time I was wearing a arm sling,
See,
so try to get rid of it because if I were to go back to work with an arm sling, it would be more challenging for me.
right.
So I believe if I want to go back to work, I have to remove this. After that, after done with OT,
Occupational therapy.
then
Right.
we did a bit of physiotherapy because, as I said earlier, I was afraid to take the public transport,
Right.
and I wasn't confident. So they helped me.
To build your
Yeah,
confidence.
correct.
Right.
So we practiced taking a bus.
You actually practiced.
Yeah,
Your therapist followed you.
yeah. They followed me and they guide me on how to take the public transport because
Yeah. You didn't want to do it alone, or you
Yeah.
couldn't. Or, well, you had to do it alone later on,
yeah,
right?
eventually had to do it alone. So initially they guide me and they reassured me that it's not that scary. So
Do you feel now, that people also on public transport are also more willing to give you help? What's your experience like?
initially, because I don't look disabled, so they think I'm normal
Yes.
until I went to get a PWD EasyLink card.
Ah.
So
Special.
yeah,
Right.
and I wear a lanyard, so it's more
More
visible
visible.
for
Yeah.
them to see.
It's the one with the yellow one, I think. The
Right.
Mine not yellow, mine is the
It's
EasyLink
just
card,
different colour.
the white one.
Oh, you've got it.
Ah,
Yeah.
okay.
I see.
So I just hang here. Then when they see, then
Mm.
they will offer seat to me.
Okay, that's wonderful.
Mm.
No, I mean that is really, really wonderful. What is your situation now, if you don't mind sharing with us? Is it better now? Are you financially also more stable?
I would say I'm still recovering, but much better than I was when I was first started.
Right. And
So
how
now
how,
I'm not scared of public transport anymore, and I'm even willing to travel further.
Mm.
further?
Yeah,
Wow.
because before I had stroke, I was
So you want to go jalan-jalan more lah?
yeah, because before I had stroke, I was a foodie, and I like to travel to.
wow.
I stay in the northeast. I either travel to the extreme east or extreme west to
Right.
get food.
Nice.
So,
You're still a foodie, are you?
yes, correct. So I guess that's why maybe because of that, I never monitor my condition.
Ah.
Oh.
Yeah.
So you must jaga still,
Yeah.
right? Gladys, let me ask you. So, how did the team at Able help you in your situation?
I went to attend for the both OT and PD because for the leg, I actually request that to them I want to more independence.
Right.
So they had actually trained me up to like how to walk a staircase, how to do simple housework at home,
Right.
how to take care of myself, like toilet
Right.
breathings, everything, so that I don't need to rely on my family members so much.
Correct.
Because at that moment I was only staying with my mom,
I see.
and my mom is actually quite old already. So it's better that I can take care of myself than rely on my mother so much lah.
Right.
So I also got trigger fingers.
Oh.
So I was also they are helping me do some exercise so that the thing would not go worse.
I see.
Yeah.
Wow. Will you encourage, from your experience that you had with Able, would you encourage others to also maybe, go to Able to seek help if they're in a situation like yours?
Yeah, of course. Because especially nowadays, ABLES have more different type of therapies.
Oh, I see.
And I think it's very helpful to patients with strokes or my kind of disability. So yeah, I encourage all those that needed help should go to ABLE.
Khairi, what do you think? Same thing?
Yeah, same thing. Also, if you need help, just you can come to Able and maybe you can share with them what you want to get out of your physical disability, whether you want to return to work or improve on, like, as for Gladys' experience, household chores or to be more independent.
Mm.
So So I say you go out and maybe you can come and seek help from ABLE. And from there, the team at ABLE will assess your condition and may offer you some program or therapy based on your needs.
Right. Wow. That sounds like it's really customized. Jeremy, I just want to come back to you. Do you feel there is sufficient aid, given and made available to persons with physical challenges and to their caregivers here in Singapore?
Well, the aid and support for individuals with physical challenges and their caregivers is actually quite a multifaceted issue. Right?
Yeah. And that must be also one of the challenges for Caritas, right?
Yeah, of course. That's why we try and support ABLE as much as possible.
Right.
And this actually demands attention and continual evaluation. Right. I think while improvement has been made in enhancing accessibility and providing assistance, there's still room of improvement. There's always room for improvement,
Right.
And Singapore already has actually quite a lot of schemes and initiatives aimed at supporting persons with physical challenges and their caregivers.
Right.
And I'm sure you've seen this around as well, right? So financial assistance programs, government subsidies, accessibility enhancement. I think that's one of the more physical things you see, right? Even on the roads, they take away the curbs and stuff like that.
Yes, that's right.
And of course, caregiver support, right? Which I think is one area which sometimes is neglected, right? Because the caregiver also faces issues, challenges helping their loved ones.
Yeah.
Right. Yeah. So, I think we should also look at the accessibility of resources and, as I mentioned, adequacy for support for caregivers. But it is with the disabilities vary very widely, right? So sometimes the government cannot, they're not all encompassing, right? So it is up to us to see how we can help support areas where maybe we see there's a lack of support. We should together with ABLE see how we can do that as well.
And so talking about support, right? What else can we do as well? And for our listeners and viewers as well,
right?
To support and also, I guess, share the joy of Easter.
Yeah, that's right.
Right.
Yeah.
So how can we help?
Yeah, anyway, as Catholics, we believe that Jesus died for us to save us, right? And now, in the joy and help and the hopefulness of Easter, I think it's important that we reflect on his sacrifice and generosity, and honor his gifts of his life by sharing of ourselves with those in the marginalized communities. And of course, you can do this in various ways. And of course, being Charities Week, one way is to donate. And of course, you can also volunteer your time with Caritas, with ABLE. Right? We're always looking for volunteers.
Right.
And basically, your donation can help provide essential resources and support for those in need and allow others to experience the joy of Easter, right? Through improved living conditions and access to necessities, right? I think spending time with individuals in need can also bring joy and companionship during Easter season, right?
Indeed.
If you want to volunteer.
Indeed. Gladys, so before we end, I want to ask you, is your family now a little bit more relieved that you can take care of yourself and that you're also self-supporting as well?
Yeah. Actually, when the day when I told her, I found a job in ABC, they are very happy and also relieved because, they can see that I try to get back my life and they are actually not that worried with me. But only, of course, come to certain inconvenience, they were still there for me to help me, especially now. My girl's also now staying with me. I'm a divorced woman.
Okay.
Before that, my children was the custody with the father.
Right.
And then my girl actually, when she was 20, she came over and stayed with me and taking care of me.
Oh, that's nice.
So
That's wonderful.
now I got a bit lazy that rely on her.
Khairi, tomorrow you celebrate Hari Raya.
Yes.
How is your family feeling now that you have gained a certain amount of independence?
I say also they are relieved because initially after I I was discharged, they were like reluctant to let me leave house.
They were afraid of.
Yeah.
You
They will ask my brother to accompany me all the time.
Mm.
But after I'm done with the rehab, I'm more independent and more confident to go out.
Mm.
They let me have my freedom to go out and to enjoy my food.
Cari makan aja ya. Well, thank you so much, and I'm so glad that things are working out for you and for you as well, Gladys. It's wonderful to see this work that Abel is doing, and Jeremy also. Thank you so much for the work of
Always glad
Caritas.
to come. and
Yeah, no,
chat.
it's also definitely our pleasure. Dear sisters and brothers, once again, this is the Faith Perspective, and we want to thank you, and I ask you to please continue to support our sisters and brothers in the work that they're doing. Nothing is for free. We know that, and so so some of the extras that we have, why not put it to good use? And you can see the wonderful work that Abel is doing, and the rest of our social service arms, and the people, the volunteers. There's so many volunteers, and actually we can ask also for volunteers. Yeah, right. So there's always a shortage of volunteers. So if you just want to put up your hand and say, "Okay, I'll try," I think they'll be more than happy to have you. Okay, so thank you so much for listening to us. Once again, this is the Faith Perspective. It goes out every Tuesday at 8:30 in the morning. And then, of course, we have an encore at 8 p.m. tonight. Tomorrow, Wednesday, at 5 p.m. And then on Thursday, it goes out at 2:10 p.m. And, of course, you want to catch up on all the other interviews that we have. You can always go to our Catholic SG Radio app, or to Spotify or Apple. And also, you can catch us on our YouTube Archdiocese channel. I'm Andre Achat. Thank you so much for joining us here on Catholic SG Radio. Take care and bye-bye. Say bye-bye.
Bye bye.